All of my interest in fitness, or most of it, has been only since I've retired. When I was working, I didn't exercise regularly. I had many years of bad habits and bad posture and all the things that lead to difficulties. And after I retired, I was doing a lot of work on my house, and I actually hurt myself, and I had to have surgery on my spine. So in the course of that problem, I joined the gym, and I worked with a trainer who was basically a young man, and it wasn't his fault, but his approach was strength, and so he was trying to build up muscles, and I think he was actually making my situation worse. And then I had to stop anyway because I was diagnosed with the herniated disc. So I continued to go to the gym and just do mostly the treadmill, just to do some cardio. And then I saw Lenny, one of Lenny's promotions, and I met with him, and he was really very helpful in terms of showing me how to do exercises and just to pay more attention to my posture and to balance and to what he calls core fitness, which seems to have been exactly what I needed. And I actually feel like I'm healthier now than I've ever been in my life. The first time I had a lot of pain in my shoulder, and I didn't know what it was. And my doctor had been telling me for years that I needed to get more exercise. And I had high blood pressure and high cholesterol, and he was telling me I needed to exercise. So, and when I was working, I just didn't take the time to do it. But after I retired, and especially when I had all the pain, I decided that maybe that would be one thing to try, because I had no excuse now. I couldn't say I didn't have time. So I had no excuse, so I went and joined the Boston Sports Club, and I signed up with a trainer, and I talked with him, and he did a fitness thing, and we did a lot of things. And I spent a lot, I bought a lot of sessions with him, and I spent a lot of time with him, and I liked him, and what he was doing was good, but it wasn't what I needed, I don't think. He was very much geared towards strength training, and I was in a lot of pain, which isn't his field, and he was very good because he would massage my shoulder and stuff, and it would relieve the pain, but it wasn't addressing the problem. I had bad posture, and I needed surgery on my spine, but the reason my spine was not the way it should be was that I didn't know how to take care of it. I didn't know how to sit straight and stand straight and exercise the right muscles and to keep it healthy, and that's what I learned from Lenny. Well, I had surgery on my spine. That was behind me, and that was all taken care of. So it wasn't I didn't have any concerns about that. I didn't have the pain that I had previously. So I was more interested in endurance and just being healthy. I wasn't feeling like I was really healthy. And so I met with Lenny, and he explained his approach, which it really made sense to me because I was a science teacher, and Lenny's very much a science-based kind of trainer. And he knows more about anatomy than I do. I was a chemistry teacher. And he would explain what he was doing and why these things were important in ways that made sense to me. And I think that's a really important thing to being successful in learning anything, is you have to believe it. You have to believe that you can do it. And when he would explain to me, this is what we want to accomplish, when it made sense to me, then I would say, yes, that's right, that's what we need to accomplish. And it worked. I had issues I had fallen and sprained my ankle. I was working with Lenny just on an overall concern about fitness. But during that time, I fell. I was cleaning my yard, and it was already, there was some frost. There were leaves on the ground and frost, and I was on a hill, and I slipped, and I sprained my ankle, and it swelled up. I thought it was broken because it's the way it swelled up, and it was all discolored. So I didn't go to the gym for a while. And then when I did, I was telling him what happened, and he was telling me that if I had better posture, I wouldn't fall, and which I didn't want to hear. But he had me take my shoes off and showed me how to, push my feet in the floor a certain way, and it actually relieved the pain in my ankle. And I was very impressed with that. That he was be able to be that specific to take the one problem I had and show me a simple exercise that I could do myself, and it actually made my ankle feel better. And I've done that. I don't do it regularly because my ankles are fine now, but it was like a good thing to know. In the course of, I'm not much of a runner. I'm not trying to train for a marathon or anything, but I just want to be fit. And so I just do the treadmill, and I wouldn't mind. I walk outside. But one of my concerns was always I felt like my knees and my ankles were weak, and that my knee, I would get a pain in my knee, and it would just inhibit me from trying to run or try to run any more, or to turn the treadmill up any faster, because I would be afraid if I got like a sharp pain in my knee that I would fall. And Lenny kept saying, well, that's because you lock your hips, which I didn't even know what that meant. But after, doing a lot of exercises and extending, he would show me how to extend my legs and to lean and just to strengthen my core and get my spine straight and use the joints and muscles in my hips better, that it should make my knees work better. And it did. After doing that, I'm much more able to run or jog, and I don't feel the pain in my knees. I don't feel like I used to when walking down the stairs. Sometimes I'd feel like, oh, what's wrong with my knee? I don't have that. That doesn't happen anymore. And I always thought my ankles, they just felt weak, and doing squats and different things. I feel now that I know how to exercise my ankles and make me feel confident that my ankles and my knees now will support me, and I'm not concerned about it. Well, my approach to fitness has changed in that until a few years ago I wasn't paying hardly any attention, and even after I joined the gym, I wasn't that faithful about or I wasn't enthused about going to the gym. I still consider it work. It's not really something that I like, but I feel more confident that I know what I'm doing and that what I'm doing is helping me. And by understanding what I'm doing and how it's helping me, it makes me feel better about doing it, and I'm much more faithful. And I exercise at home almost every day, and there's a lot of things that Lenny showed me that relate to core fitness that is easy to do at home. It's just isometrics and stretching and things like that, and I can feel the difference from having done those things. That's my ankles and my knees feel better. I feel that my posture is better, and I feel more healthy. I mean, some people have commented that I really look good, which is always nice to hear, and it's not anything specific, but I do attribute that to, like, I think if you feel good, maybe you'll look, if you feel better, you'll look better. I think I've lost, I've lost a little weight, but I think also I don't have the pot belly that I had years ago, and I think people notice that. Problem I had that we haven't mentioned before is I used to have this problem, which I didn't know what was wrong, but I would get lightheaded. And I was taking blood pressure medicine. I thought it was something to do with that. So if I would get up from a sitting position and I would get lightheaded, like I could feel like, I never fainted, but I would feel like I was moving that direction, and it was troubling. And that went on for a long time. It was never bad, but it was always there. And so, like, I'd be out with friends or something, I'd say, when we go outside, I'm going to stop for a minute. What I would do is I'm sitting in say in a restaurant or something, we'd get up and go outside. I would stop and stand still and you know, catch my breath, which seems like, you know, what's the matter with this guy? He can't walk, you know. And I could go on the treadmill for 40 minutes, so it wasn't that I didn't have endurance to be on my feet or to walk, but it was just something that was happening and I didn't understand it. And working with Lenny, he just taught me to pay more attention to my breathing, and it was mostly that I wasn't breathing well. And I was, you know, holding my breath sometimes when I shouldn't be, and he you know, just told me to pay more attention to my breathing, which I started doing. And now by paying attention to my breathing, I don't have that issue. And some of those friends of mine that would say, you know, look at me with sympathy, like, what's this guy can't walk, would say, oh, that trainer's really doing a lot for you. Well, about coordination and balance, it's something I didn't really, I know what they are, but I didn't pay any attention to it. I didn't think about it. But as part of the program that I do with Lenny, he's taught me a lot about that, and I can feel the difference. Just the idea of keeping your weight centered when you stand up, and it's better for your posture anyway. You're not leaning on one hip and things like that. But when I walk, I keep my weight centered, which is the same thing that Lenny teaches. Like when you're running, it's when to transfer your weight and like that. But by paying attention and standing up straight and having my weight centered and moving my weight deliberately from one foot to the other if I'm walking or running, I can absolutely notice the difference, that I feel more balanced and I feel more coordinated. My daughter got married last year, and when I was a little nervous about dancing at the wedding with her, and the you know, the keeping your weight centered and taking one step at a time, and Lenny and I did actually, as part of the workouts, a couple of times do some dance steps. And we didn't dance together, but you know, we each would do some dance steps, which is also a good exercise because it keeps your weight centered and it gets you to coordinate. And when I went to the wedding, I felt much better about that part of it too, that I was actually able to dance and not feel as awkward as I probably would have otherwise.